My topic is embryo transfer. Introduction. Embryo transfer refers to the step in the process of assisted reproduction (IVF) in which embryos are placed into the uterus of a female with the intent to establish a pregnancy. ET can be of two types: fresh embryo transfer, fresh from fertilized egg cells of the same menstrual cycle; frozen embryo transfer. They have been generated in a preceding cycle and undergone embryo cryopreservation and are thawed just prior to the transfer. History of embryo transfer. The first successful embryo transfer was carried out in rabbit 1890 by Heap. First lamb by ETT 1946 by Berry. First calf by ETT 1951 by Willett et al. In Spain 1951 by Kwansnicki. In African buffalo 1983 by Doss et al. University of Sunday claims first sex sorted pregnancy by embryo transfer 2020. Steps involved in embryo transfer. Uterine preparation. It is stimulated or a cycle where a frozen embryo is transferred. The recipient woman could be given first estrogen preparation about 2 weeks, then a combination of estrogen and progesterone so that the lining becomes respective of the embryo. Second one, catheter. There are different types of catheters used in embryo transfer. They vary from each other by volume of media, constitution of the medium loaded in the catheter, loading with using fluid alone or mixture of air and fluid in the catheter. There are two common techniques: air loaded method, continuous fluid method. This is the diagram of occurs in uterine tube and also in uterus. 2-cell stage, 4-cell, 8-cell, morula 16 cells, blastocyst 70 to 100 cells. Embryo transfer technique. The embryo transfer procedure starts by placing a bivalve spectaculum in the vagina to visualize the cervix, which is cleanized with saline solution or the culture media. Transvaginal embryo transfer. There are two types of embryo transfer methods. Blind insertion. First one, blind insertion. The loaded embryo transfer catheter is introduced through the cervix to pass the internal OS and then gently advanced in the mid-uterine cavity and stopped from 1 to 2 centimeters short of the fundus. Some patients experience suprapubic heaviness and discomfort. After 1 to 2 minutes, when this complaint disappears, the embryos are ejected slowly. Catheter is left inside for 30 to 60 seconds. Pressure is kept on the plunger of the syringe while slowly withdrawing the catheter out, avoiding negative pressure. After embryo transfer, the catheter is checked for any retained embryos. If found, retransfer is done immediately. Then bed rest 30 minutes. US guidance ET. The clinical use of abdominal ultrasound in addition of visualizing the catheter is to straighten the uterovesical angle with which might make the insertion of the catheter easier. Under US guidance, outer sheath of embryo transfer catheter is passed just beyond the internal OS. The inner sheath is loaded by the embryologist who then assists the physician in threading the inner sheath into the external sheath. The inner catheter is slowly advanced by the physician and the embryos are deposited 1.0 cm from the fundus mid-uterine cavity. After 5 to 10 seconds, soft catheter removed first, while outer catheter withdraw past internal OS laboratory check. Rigid outer sheath removed and checked. The catheter is gently rotated and removed over 15 seconds. After the embryo transfer process completion, a pregnancy test has been carried out to confirm the success of IVF. The babies produced using these approaches are called test tube babies. The first test tube baby was born on July 25, 1978 and was named Louis Joy Brown. The Nobel Prize of the Medicine for the year 2010 was awarded to Robert G. Edwards for this outstanding invention. Application of embryo transfer: faster genetic improvement, genetic screening, disease control, import and export, circumvention of infertility, twinning in cattle, conservation of endangered species, research, production of clones, and genetic engineering. Disadvantages of embryo transfer technique can be prohibitive and the success rates are less than AI. Cost and maintenance of recipient females requires a technician with the skill to flush embryos from the reproductive tract. Possible spread of disease through recipients. Thank you.